Good day to everyone. My name is Paul Wax. I'm the Executive Director of the American College of Medical Toxicology, and I'd like to welcome you all to our web series entitled Medical and Public Health Considerations of COVID-19. Today we're going to have a very special presentation on school reopenings during COVID-19. Next slide. I'd like to thank all of our webinar series partners. Next slide. This webinar will be recorded and posted to the ACMT webinar page. Typically within 2 days, you'll receive an email to that effect when it gets posted. It'll be up on acmt.net/COVID-19 web. We also have been developing a series of FAQs on our webinars, and this is also posted on our website at acmt.net/C19FAQ. Finally, if you have any questions about this webinar series, feel free to contact us at info@acmt.net. Next slide. There will be a question and answer period toward the end of the webinar. This is one of the highlights of each of our weekly webinars, and feel free to participate. In order to ask your question, you'll need to type in the questions either into the Q&A box or the chat function during the webinar, and we'll try to get to as many people as we can. We also are simulcasting this on YouTube and Facebook Live, and you can also chat in questions on those two media as well. Next slide. None of our speakers have any conflicts of interest to disclose. Next slide. I'd like to thank my co-moderator and my co-chair for this webinar series, Dr. Ziad Kazi, who's a board member of the American College of Medical Toxicology and president of the Middle Eastern North Africa Clinical Toxicology Association. Next slide. I'm delighted to welcome one of our guest moderators for this webinar, Sharon Van Norrisdale. Sharon is the Director of Education and National Emerging Special Pathogen Training and Education Center, and she's the Program Director of Serious Communicable Diseases Unit at Emory University Hospital. It's really a delight for Sharon to join us, and she'll be leading the Q&A toward the end of the session. Next slide. We have a very special and important topic, and this is a slide from 4 headlines that just appeared in the newspaper this morning. As we know, the topic of school reopening is on the tip of everyone's tongue. It's very emotive, lots of opinions. The purpose of this webinar is to bring science to the discussion and to have an evidence-based presentation. Next slide. So on that note, it's my delight to introduce our 2 speakers for today. Our first speaker is Claire Barnett. Claire is the founder and executive director of the Healthy Schools Network, and she'll be discussing the recently released National Call to Action for state public health agencies to provide all schools an authoritative school infection prevention and control plan to adopt. And following her presentation, we'll move seamlessly into the second presentation by Allen Barkkume. Allen is an industrial hygienist for the New Jersey Work Environmental Council, and he'll be discussing occupational health and indoor air at the school. Following these 2 presentations, we will open up the Q&A. On that note, we can move to the next slide, and Claire, you can begin. Thank you very much.
I'm going to lead into our report by giving you some background about schools and about children and what's going on inside schools even before the pandemic. And then we can figure out why the pandemic is such a challenge. In our view, frankly, public schools today are probably in the worst possible position to meet the challenges of the pandemic and reopening. It's very, very difficult. Let's start by framing the issues. Children are not just little adults, and I suspect many of the attendees understand that. They're uniquely vulnerable to environmental health hazards. They're still developing, they have specific behaviors, they can't recognize threats or articulate their exposures. They also have a long shelf life, so anything that gets in the way or disrupts development now is going to be reflected in later life. By the same token, I want to stress this. Schools are not just little offices. They're very densely occupied, 4 times more densely occupied. There's a lot of sound. There's a lot of background sound here. Thank you. Schools are not just little offices. They're 4 times more densely occupied than offices are. Occupants are 95% women and children, two of the more vulnerable subsets of the population. There are always a mix of processes and products in use under one roof and often in one ventilation system. There's a long history, well documented, of poor schoolhouses, poor facilities, problems with air quality, problems with sanitation, problems with plumbing, with molds, with chemical mismanagement and legacy toxics, and also no consistent funding for facilities and very little oversight. The scope of the problem is really enormous. There are about, and I'll speak here about public health, public schools specifically, about 13,000 public school districts across the country, enrolling 51 million children and employing 5.5 million adults. About 20% of those adults are over the age of 55. Among the children, 42% of all the children in public schools are children of color. 39% have no internet at home or device access. 29 million are using subsidized meal programs within their schools. 7 million in special ed. And with our friends, the school nurses, inform us about 25% of all children in public schools already have chronic illnesses. This is really kind of an extraordinary way to start a problem. All states require children to go to school. School and child care facilities have environmental health problems that impact children's health, thinking, and learning. And while our focus here is primarily on public schools, I just want to remind listeners today, many of these things also apply to private schools as well as to child care, but I'm going to use the word school. No federal agency has the capacity or the authority to identify, track, or remediate problems in schools. While OSHA covers all private schools, employees in private schools, about 24 states have adopted state OSHA plans to address problems that employees in public schools note. Yet no state provides environmental public health services for children at risk or with suspected exposures in these settings. And what is worse is that we know, and again, this has been documented for 60 years or more, the poorest children from the poorest communities always have the schools in the worst physical condition. The picture on the right is illustrative. It's not necessarily a poor school, but this is about carbon dioxide, CO2. Research indicates that adult critical thinking skills begin a steep decline at 1,000 parts per million CO2. This classroom shows over 4,000 parts per million. Research in U.S. classrooms has shown CO2 levels often between 2,000 and 3,000 parts per million. So let's look at some of the problems that come with schools. And this is the most, we're going to deal with 3 levels here. This is the most expensive kind. Well, legacy toxics embedded in old school buildings. Asbestos and Pcbs are very prominent. They're in the news. They're both subject to EPA regulations in different ways. One of the things that the picture on the left shows is what happens when there's an unattended leak in the roof. This is a partial ceiling collapse in a very old, 70-year-old school building. What it has revealed is more asbestos, growing molds, and then on the left side is flaking lead paint. On the right behind the PCB warning sign is what's called a fence line school. And what's interesting about fence line schools is the estimate is that there are about 5 million children in 12,000 individual school buildings that are within 1 mile of a high hazard industrial facility such as this one. That is an extraordinary challenge, and these are very difficult, very expensive issues to deal with. This is sort of the mid-level of what happens with poor maintenance and poor indoor environments. If schools are not current on their maintenance and repair, and every homeowner knows what that is, then they develop all kinds of problems that can become very expensive. Obviously, a broken toilet can cost some money, but it's it's not the same cost as de-leading a building. Top left is a very wet classroom with a leak in the ceiling. The wall is wet. Those peeling lead paint is coming off the plaster wall. The fan is designed either to cool the room or perhaps to dry out the wall. But in fact, what it's doing is blowing lead dust across a classroom. The center picture is a custodial closet. For people who are parents or perhaps agency folks on this particular webinar, you are always allowed to ask when you're doing a tour to take a look at a custodial closet. If you see something that looks something like this, you'll know you're not in a very clean school. You cannot have a clean school with a dirty custodial closet. Custodial products and custodial equipment like this are not very expensive, but they do need to be current and they do need to be updated. On the right is a picture courtesy of the U.S. Environmental Protection Agency of chemical mismanagement. And chemical mismanagement has been documented through CDC's SHIP survey as well as through EPA's programs. Those are clearly not necessarily original containers, some of them with new labels, questionable content, very expensive and very dangerous. And this is the cheapest one. It was probably expensive to put together, but we call this a hoarder classroom. And it is filled with indoor environmental challenges. It's filled with dust captures. It would be difficult to determine how to clean a classroom that looked like this. It would be even harder to determine where you might apply a disinfecting product. Pests are often drawn to food and plants in classrooms, which creates another problem. With all the materials hanging from the ceiling, airflow is impeded. And many of the materials hanging from the ceiling and around the room are in fact fire hazards. The actual cost to clean this up is zero. Simply means cleaning out the building. Turning now to the pandemic. So the context of poor facilities in poor condition, there's also a disproportional burden of the pandemic. The Black, Latinx, and Native American communities who have been hit hardest by COVID are going to be sending their children back to the poorest schools in the worst condition. And this means schools without ventilation, without sanitation, without working sinks, and sometimes without working toilets. We are very concerned that any kind of fragmented local approach will not only speed the spread of the virus, but it will deepen these crazy disparities and sow confusion. So our call to action on behalf of our national coalition partners, there is a National Coalition for Healthier Schools. My office coordinates it. It is very loosely held. It has about 1,000 different members, both organizations and advocates. And we were very, very pleased that the New Jersey Work Environment Council, WEC, stepped up and wanted to work on this issue with us. It's been a terrific partnership and we're really grateful to them. So the national call to action, pandemic versus schools, and asking state agencies consists of the following. And I'm going to focus on the first part of it and then turn the presentation over to Allen from WEC. This is a public health imperative, keeping children safe at school. If you cannot keep them safe at school, education will not take place. Social and emotional learning will not take place. Subsidized meals will not be fed to children. So it's really important to get the building right and get the occupancy right. We see a state's role as providing public health guidance to schools. We wish the states would convene stakeholders, multiple stakeholders, parents, teachers, administrators, community folks, other public health experts, to develop template school infection prevention and control plans. This is built a little bit like school emergency management plans, and I can imagine that many people on this webinar today know what a school emergency management plan is. They typically tackle one-time events, a tornado, the hurricane, a new flash flood, one sick child, H1N1, or mass shootings, one event, a single event, horrific, but a single event. The pandemic has a very long arc. There are many people saying this is 1 or 2 years of a long arc of a pandemic. So we looked at this and said we need a policy statement adopted by local schools that will talk about how to handle all the issues that need to come up. We also want states to establish hotlines and a system to follow up on complaints, as well as mandated protocols for schools to report attendance and new infections. At the local level, local schools should also convene stakeholders to look at the template plan, make tiny adjustments to it within the public health guardrails, and then adopt it as board policy. Because in fact, the condition of school facilities will affect the transmission of the virus. And for that, we will also turn to some of the occupancy issues and the vulnerability of staff inside schools. About half the report, 49 pages, is in appendices, federal and other resources, details on indoor air, opening water systems, cleaning and disinfecting, and certain kinds of symptoms of COVID versus flu, asthma, and allergies. So in terms of states guiding the schools in slowing the spread of the virus, we want these template plans to specify how the facility will be operated and maintained to reduce the presence of the virus, and how occupancy rates and occupants will be managed for optimal health and learning. Reopening a facility is not as simple as unlocking the front door. Many of these old buildings have been closed. Old and new buildings have been closed since the middle of March. They may have been closed for 3 full months or longer. So they need routine inspections. They might have an annual fire safety inspection that needs to take place. They should be assessing the exterior, if there's been any damages or changes to the exterior of the building since it was last occupied, and also look at the interior spaces. When they do that, they need to prioritize cleanups and repairs and save that list. They also need to check the building systems, flush out the drinking water systems. Does the ventilation system work? Does the plumbing work? Do all the toilets work? Do all the drinking fountain work? Do all the sinks work? Check them all out, electrical and communications. And with that, you also need to update and review the emergency management plan. Since all schools have them, there will be emergencies, regardless of whether there's a pandemic or not. And if you have staggered occupancy rates, people coming in and out of the building through different doors, using different hallways, using different bus routes, perhaps reassigning classrooms, you need to rethink, have you done everything you need to do with the emergency management plan for the coming year? And most importantly, for certainly as we've heard repeated night after night about PPE shortages and mask shortages throughout the country, wherever there's a surge of the pandemic, schools also need to inventory and stock their supplies. They need their products and equipment for cleaning and disinfecting. They need masks. If teachers are going to wear masks, they must provide masks to teachers. Some people on staff will need personal protective equipment. They need ventilation filters, water filters, soap, hand sanitizer, paper towels, and so forth. There's a lot of supply that goes into schools on an annual basis. We'd like to see them stocked up for the first semester. If they can do all that, and this is a challenge, particularly opening water systems that have been closed for a while, they need to be able to stay open, because in fact, that's the end game. How long can you stay open before there's a closure that comes your way? So that really has to do with maintaining and cleaning the facility once you've opened it. And that requires a really firm schedule of cleaning and disinfecting, particularly those high-touch surfaces. It also, you need to respond and track what's happening with the facility. So there needs to be a complaint and illness connection here. And what happens with that is, if you do understand what's happening in the building, because one wing of the building may not be like the other wing of the building in terms of ventilation and airflow or cleaning, is you need to be able to update and maintain the schedule to address one-time or persistent problems. And then this is why you need the list. That list of prioritized repairs is because there will be closures. Everybody that we know that we have talked to in forming this plan of action is anticipating there will be closures. Not state by state, but there will be closures scattered all across the country. Now, the benefit for a closure for a building, a large facility, is that it is an unexpected opportunity to address those priority repairs. You may not be able to close a bathroom to fix 2 broken toilets while the school is fully loaded with children, But if there is a closure for a week, you can probably get in and take care of that and several other things at the same time. And that's why that priority list is really important. I'm going to spend a little time now, talking about the cleaning, sanitizing, and disinfecting. I suspect, given the medical professionals on this call, I may not have to do this, but we'll run through it quickly anyway. Cleaning is just basically soap and water to decrease the presence of the coronavirus on surfaces. Sanitizing is really what happens in restaurants, food prep areas, school kitchens and cafeterias, and food service and prep areas. Disinfecting is a process for disinfecting, deactivating viruses on surfaces. But remember, the viruses return every time dirty hands or droplets touch the surface. It's important to know that not all disinfectants will kill the coronavirus. Only specific, they're registered with EPA based on what they can deactivate or kill. So it's really important to read and follow all the directions on the label exactly, including the product dwell time. Now that means the amount of time the wet disinfecting product sits on a clean surface before it has deactivated or killed the bacteria or the virus. A dwell time can be anywhere from a few seconds, 20 seconds, to 10 minutes, depending on what the product is. So it's really important to read that. And the warning that we offer always on any kind of disinfectant is not to overuse them, and certainly not to allow children to apply disinfectants or to use disinfecting wipes. In fact, the instructions say not for use by children. Generally, cleaning and disinfecting goes through many different steps. I won't dwell on those in detail, but it always begins with inventorying all the supplies and restock as needed. My organization formed a Cleaning for Healthy Schools collaborative more than 10 years ago. We still host that website, and there's a great deal of material up there from school nurses, from American Federation for Teachers, from the National Education Association, school nurses, New York State. There are currently 12 states that either mandate or heavily promote the use of third-party certified green cleaning products in schools and for state agencies. And that's where a lot of this material is drawn from. As you probably know, the disinfectants that will deactivate the coronavirus are on EPA's what they call the N list. The N list has everything on it that will deactivate the virus. But within the N list, it's possible to cull it for disinfectants that have a lower impact on human health. The other thing that I want to bring to your attention, and this is on the in the appendix on cleaning and disinfecting, we have permission from Green Seal, International Eco-Logo Organization, to show this chart, which is which things should you be using for disinfecting. So the EPA N list, of course, is a yes, and that's green on top. Electrostatic spraying, the science is not there yet. Ultraviolet ozone or steam, more information is needed. EPA and CDC are reviewing its effectiveness. Fogging, absolutely not. It increases hazardous chemical exposures and provides no added benefits. Ultrasonic waves or LED blue light, again, a no. There's no data to suggest that works. I think these are really important things to understand because schools, we know, are spending a lot of money on foggers and other kinds of products that may not be fully effective. So in our Cleaning for Healthy Schools website, we have a number of different startup tools for schools, and these are really meant not so much for parents, although we have tip sheets for parents. These are meant for how schools can get started and what they can do to run a better cleaning program, which is really important. So there are tips for school staff, ways to deal with vendors who approach schools about buying certain kinds of products, how to evaluate a building for its cleaning needs, not just for green cleaning, but for all kinds of cleaning needs. NIOSH, the National Institutes of Occupational Safety and Health, has published on cleaning chemicals and health. And I do want to call attention to New York State's Green Cleaning Program. It was the first in the country back in 2005, and it has significant resources there. including a full list of all the products that New York State approves for cleaning schools and all public agencies, including state hospitals in New York. So this is it's a really important tool, and we're happy to see it. And now the last one I want to focus on here is really the disinfecting side. It's important to realize, and this comes directly from a New York State memo from the State Health Department jointly with the Education Department in New York. I think it was in February this year, 2020, making the point that cleaning is you have to clean the surface prior to the use of disinfectants because disinfectants can't break up the soil. And number two, then you apply the disinfection. So the examples of the frequently touched areas in schools, and this is a short list. The memo here, and all this is hot linked on the actual presentation here, is quite extensive. The classroom desktops are filled with little bugs, according to all the research, and chairs, lunchroom tables and chairs, door handles, push plates, handrails, faucets, light switches, buttons, and so forth. And so one of the reasons why scheduling all this comes into play is because you have staggered sessions, a morning session, for example, and an afternoon session with different sets of children coming in. Are you going to do a disinfection of hard surface, frequently touched areas in between those two sessions? Or is it going to be day by day, and you'll clean in the morning Monday and have a clean classroom for people to use all day Monday, and then clean again for Tuesday morning and have a different set of people Tuesday? So there are a number of different scheduling options here, and we're not telling people exactly how to do the scheduling of children, but it's important to realize the logistics involved in trying to reopen schools and all the things that people have to think about. And with that, I'll turn it over to Allen. Allen, thanks so much.
Great. Thank you, Claire, for starting us off there. And I'm going to be reiterating some of the points that Claire brought up already. And thank you to everybody for having me today, and thanks for taking the time to come and learn about the public health implications of reopening our nation's schools. So just should give you a little bit of an introduction about myself here real quick. I work for an organization called the New Jersey Work Environment Council. We focus on labor and environment together, and the majority of my work is to ensure a safe and healthy work environment for educators. So I work for the New Jersey Education Association. We have about 200,000 members and over 1 million students, 2,000 buildings. So I'm here today to focus on the topic of occupational health from the perspective of indoor air quality. I think it's a really critical issue here. Indoor air quality is one of the most important topics, considering that the CDC's most recent salvo to repopulate our national public schools, in spite of mounting evidence for the transmission of SARS-CoV-2 in the form of aerosolized particles. But in addition, the threat of an aerosolized virus is not enough. We really need to see that up against the stark reality of the condition of our public schools. They lack adequate air quality controls. So to point this out here, the photos you see here on my first slide, not only do I work for the NJEA now as an industrial hygienist, but I was also a member. I was a teacher and worked in this building that you see here in the upper left. I worked in that building for 11 years at Bloomfield High School in New Jersey. That picture is from 1922 because the school was built in 1922. The picture in the middle, just below that picture, is the same school around 2015. The school is still in operation. Further along, you see a similar building, also from the early half of the century, and then the same school all the way on the right. That's an elementary school, and that picture is taken from the school's website yesterday. So these represent a lot of the building stock for our public schools. Real quick, the National Center for Educational Statistics has some numbers. Granted, they're from 1998, but they found that 45% of public schools were built between 1950 and 1969. That's baby boomer generation. and then another 28% before 1950. So our public school buildings are old, and that's really important when it comes to indoor air quality. Okay, I'm going to go to the next slide real quick. So before we even talk about opening buildings, we should consider that this is happening after a long period of dormancy. So number one, we have to follow standard procedures for checking fire, electrical, water safety for starters. But there are also many potential hazards besides infectious disease, and these hazards are more numerous and bring more risk because of the fact that public school buildings as a whole are not modern. That is to say, they're not like new commercial construction. Any place that you do your shopping, for example, is new commercial construction, very different from a public school building, and in the way that they function and handle their air quality issues. So I just wanted to kind of point out some of these other hazards that are there that kind of get multiplied by the age of the school building. Switch to the next slide here. Okay, and considering that indoor air quality is a critical factor in reopening schools, and that was before the threat of an infectious airborne disease that is likely to be spread via aerosolized particles, being that indoor air quality is an important issue, I just want to take a look at some of the tools that we have in the national toolkit to deal with this. So already many states have IAQ policies that follow some of the EPA's Tools for Schools program, which is really helpful. It helps schools deal with their indoor air problems. It's a great resource. The EPA more recently released information on ventilation for high-risk areas, such as nurses' office, isolation rooms, and restrooms. So I just want to point out these few items as helpful resources that we should all be using going forward. And the next slide, I want to zoom back out for a minute here. So if we know the state of our buildings and we know indoor air quality might be an issue, but I want to look at the overall plan of how we intend to control this disease. So what we came up with here is a really general plan. We think that every state should have something that looks like this, and then every school can adapt it to their needs. Obviously, they're all going to have different needs. So based on the state's plan, then every school would need to prepare their own plan, and they put that plan into a handbook, which is then distributed to the school community. That way, everyone knows what the policies and procedures are and what to expect. Students and staff especially need to be trained on how the plan works prior to the school reopening. So I've listed here on the slide just an outline of topics for consideration, of which there are many. We've tried to narrow this down to the topics that are most representative of the myriad guidance documents that are out there, from federal CDC guidance, state level Department of Education, educator union guidance, to authoritative trade organizations, association guidance. That's where all this comes from, just to give you an idea. And I'll spend a brief moment going over these, but then we'll again focus on indoor air quality, see how that fits into this particular infection control plan. So it all starts with staffing, because if you don't have enough people to implement and maintain the items that are outlined in your plan, then you can't enact the plan. So that's number one. Do we have enough staff to do this? Number two, and this is the absolute most important aspect of hazard control, is screening. Keeping infected individuals out of the building is worth all the other controls combined and cannot be stressed enough. It is difficult. This is the point where I encourage everyone listening to really demand a national response to our inadequate testing and tracing capacity. The fact that we don't know who is sick and who is not makes all this planning so much more difficult and raises the risk to the point that many are afraid to return. There are too many unknowns in the form of asymptomatic carriers, and changes the entire risk analysis when you have that much uncertainty. So staffing, screening. Next, the infection control plan must consider how at-risk populations, both students and staff, will be handled. Be very specific with your masking policies. Another one, who wears them, when, and under what conditions, what are the exceptions. You should also probably try to educate everyone on the difference between face coverings for source control and PPE for respiratory protection. These are not the same thing. And in order for the plan to work right, people need to be educated on the difference between these two, because that way we can communicate with each other more. So more considerations. How about transportation? How long are these students on the bus? Is it long enough that you need to clean the bus in between runs or not? Are they on for 15 minutes or for an hour? How do you transport a student that went to school, but now they look like they're sick and we need to send them home? And who drives that bus? And what do you do with it afterwards? How do you clean it? How often do you clean your bathrooms? How often are the bathrooms used in the first place? So all of these issues will change from school to school, and you need a whole committee of people to figure this out, by the way. It can't be a few administrators. You need to have as many representatives from the community as possible. Stakeholder input is the only way to get this plan done. And I've just gone over this really quickly, and I'll address maybe more of these during the Q&A. Switch over to the next slide here. I do want to mention, because I just mentioned face coverings versus PPE. So now that we're looking at this hierarchy of controls page, I'd just like to mention as a reminder to everybody that PPE is a control method of last resort. See, it's at the bottom of this pyramid here. I guess I should introduce this pyramid. This is the NIOSH. That's the National Institute for Occupational Safety and Health. So it's the research arm of OSHA. Sorry. I'm not sure if the pyramid is familiar to this audience, but it's a framework for protecting workers and all building occupants from recognized hazards such as coronavirus. Whenever you're coming up with a plan, you need to use this to prioritize your plan. So, and again, I'll show you, see, PPE is at the bottom of this pyramid. It's a control method of last resort, and that's because it relies on many things in order for it to work. Again, this is PPE in the form of an N95 respirator, for example. It requires a lot of things in order to work, and one of those things is human behavior. And this is something that we can see through the lens of our national discourse at the moment. It can be quite complex. So we don't want to rely on PPE alone. We want to go up to the top of that pyramid. So at the top of that inverted pyramid that we're looking at here is the most important thing I mentioned before, is elimination of the hazard. So in regards to infection control, that means keeping infected people out of the building. And that really requires a substantial testing and tracing capacity. And I'm not saying that schools need to implement this, but community that the school is within and the county and the state that they're in need to have an adequate testing and tracing capacity in order to get this control into the plan. So some states and some regions may have reached adequate capacity for this, but on a national level, we're lacking. And therefore, unfortunately, although we'll do the best we can to screen staff, students, and limited visitors that come into the building, we still have to rely on other controls as well. And then I'm going to start going down the pyramid. So in the absence of formidable testing and tracing regime, we must rely heavily on engineering controls, such as maximizing the introduction of outdoor air for ventilating the building. That's an engineering control. It doesn't rely on human behavior as much as with PPE. There's also administrative controls, which we mentioned earlier in regards to staffing concerns, for example, providing access to sick days for workers or isolation time, for example. Staggering schedules is also a kind of administrative control, or cohorting students into groups that don't mix with each other. That requires some administrative work to get done. Again, these the efficacy of these controls in some way depends on human behavior, and then the further you go down the pyramid, the more it depends on that. So we want to have a combination of these controls in order for this plan to work. Go to the next slide here. Okay, so now we get into some more technical things. So if you're trying to make it an effective plan, a reopening plan for school, and you're trying to minimize the risk of infection, you have to properly characterize the hazard. So what does it do? How does it work? So again, ventilation in this case is a key issue as seen from exposure science of recent. So is this coronavirus transmitted via respiratory droplets? Yes, that's been confirmed by all major authorities. Here we see the statement from ASHRAE, the HVAC engineers. They put this out pretty early on. But is it transmitted by aerosolized droplets? These are particles that are so small they behave more like a gas, which means they can stay suspended in the air for long periods of time. They can get more likely that someone will be exposed to an infectious dose because it's just hanging around in the air instead of falling to the ground. So is it aerosolized? There's not enough consensus on this. And there's also disagreement about where to draw the line between a particle and an aerosol. Ultimately, we should be following the precautionary principle and assume that they are aerosolized, but knowing that that would come at a great cost, because the kind of controls that you need against airborne droplets, so to control that, use face coverings. Those controls versus the kind that you need for a virus that is more gaseous, if you will, they're very different controls. And the aerosolized version of a virus requires much more strict controls. And our school buildings are not up to the challenge. So the CDC doesn't recognize the aerosolization threat. The WHO, at least since a few weeks ago, put out a formal statement in which they sound much more worried about it, but the CDC is not, and this puts schools in a precarious position. Schools, for the most part, across the country are not designed to protect against an aerosolized virus. So back to the first image I showed you, high school from 1922. 75% of schools were from before 1970. So here's another one. So this is on the slide here from the Government Accountability Office. HVAC systems in 36,000 buildings should be updated or replaced. Okay, I really got to point out here, these are only the schools that already have HVAC systems. A lot of schools don't have HVAC systems. I've worked in many of them. I've dealt with hundreds of cases in New Jersey. They have what's called operable windows. You open a window to get fresh air. Okay, so look at that GAO stat in the context of these are only the schools that already have HVAC systems. And consider what these numbers look like as they're distributed across the country. This relates to something that Claire brought up about the disproportional burden. The poorer the town, the poorer the region, the less likely they have a well-ventilated building. All right. So, and a virus that spreads through the air, buildings without air handling systems should be a serious concern. Let's go to the next slide. Okay, so I hope you can see how the aerosol issue is so critical to this problem of getting back to school. This is my last slide here. So right here, I'm showing you what are essentially the minimum standards for air quality in any building in the U.S. These standards, however, are only for buildings that already have mechanical ventilation. They are not applied to buildings that have operable windows, as I said before. So I should mention that a school that's being used as a coronavirus testing center here in New Jersey was shut down yesterday to coronavirus testing because of extreme temperatures. That school does not have a properly functioning HVAC system. It's been 90 degrees for almost 2 weeks here, and they had to shut the building down. And that's just for coronavirus testing. Just want to make the distinction between buildings that have HVAC systems and those that do not. It's not a requirement for them to have it in public schools. Okay, and again, some of the things that are listed on this slide. So if the school does have a properly functioning, well-maintained HVAC system, they should already be following these standards for thermal comfort. Those that have good facilities managers should be implementing these filter controls that you see here. We get these questions a lot. These are some things that will probably come up in the Q&A, so I don't want to go into too much detail right now. Instead, what I want to reiterate is that the ASHRAE standards are the bare minimum. These are engineering standards, not health-based standards. Yet these are the standards that are used to create a lot of the guidance that's out there. So just to give an example of what a health-based standard is, New Jersey has a health-based IAQ standard. One of the things that it specifies is 1,000 parts per million of carbon dioxide as a proxy metric for adequate airflow. Remember Claire's slide before showing classrooms that can get as high as 2,000, 3,000 ppm? And I can personally attest that those numbers, number one, they're very, very high. They're also very, very common in public schools. And CO2, what does that mean? CO2 is, it's increasingly now being seen as detrimental to higher cognitive processes, which is kind of ironic in a school setting, but levels that high, they're not hazardous. The thing is, CO2 is used as a surrogate gas. It's a proxy for ventilation. If the CO2 that we exhale is accumulating that much, what else is accumulating in the air and not being ventilated? Okay, so this is just bad ventilation, but it leads to odor issues, respiratory complaints, things that can be way, way worse. And again, that's before the threat of an airborne virus that may be, or looks like it may be, an aerosolized virus. Back to standards real quick. California also has a health-based standard here that obviously applies. It comes from protecting healthcare workers and is based on practices that have been evolving since tuberculosis, which is a highly infectious and transmitted via aerosolized particles. So that's been used as a model for all infectious airborne disease in this case. So the ASHRAE standards that are being used as a basis for all the infection control guidance that you read out there, they're minimum standards, not health-based. Let's keep that in mind. And also, there are other examples out there of standards that should be integrated into the reopening plan because they're made with protecting health as the goal. So that's why I want to bring up these other standards here. So in closing, I want to reiterate my main point here, which, as well as some of Claire's, old buildings, poor maintenance, well-documented problems with cleaning and lack of sufficient ventilation all put our schools in the worst possible shape to deal with an airborne virus. Thank you again for listening. I look forward to answering some questions in a minute, and I'm turning it back to Claire here for the next slide. Thank you. All right, maybe I'll look forward for Claire here.
Thank you, Alan. It's really powerful material when you understand how many old buildings out there are and how poorly they've been cared for over many years. It's really a tough time. I do want to focus on sources of support for public school facilities. The first thing to know is that I'm based in New York State, Alan's in New Jersey. Both our states contribute to school construction and renovation and repair. But there are only 2 out of the 38 states that do that. There are 12 states that do not do anything. There are no grants, no assistance for public school construction. So we'll look a little bit at the federal side here. There are no routine, regular sources of federal support for schools with a couple of exceptions. One is federal emergency management. If there's a disaster, FEMA funds can help rebuild. Tribal nations have their own source of tribal nation schools, but the buildings are not in great shape. I'm sure plenty of nations would be happy to describe how they need more support for their school buildings. And then the third area is military impact zones. So if there's a build out of a new military base, there would be assistance for building a school. In the states, as I mentioned, only 38 currently provide some sort of grant support for public school facilities, and even some of those have wavered in their support, withholding support for a year or two, targeting a particular city for no support for a year or two. So what happens is, even in the states that are providing some support, is that the poorest communities will always have the school in the worst condition because they're relying on local property taxes, and a poor community is not going to be able to come up with all the tax funds to do it. So even in a state like New York, which has incredible wealth disparities, you have in state aid calculations, you have some districts which are extremely wealthy, which have minimal state aid for school construction, say 15% or so for state funding, and others which have more than 95% state aid. Even with 95%, they may not be able to front the cost of a full building construction. There are a couple of proposed federal sources that are under discussion this week and next week and whenever it gets settled. One is the Reopen and Rebuild America Schools Act of 2020. For the current fiscal year, it would send $10 billion, that B for billion, to help reopen the poorest schools. The overall act, originally designed a couple of years ago, if it's approved, would send $100 billion over 10 years to rebuild America's school infrastructure. So that's on the bricks and mortar side. On the program side, US EPA has a very successful long-standing program on healthy school environments, primarily orchestrated by the Indoor Environments Division, but also other offices within EPA have played a role. In the current administration, this president's budget for FY20 last year and for 21 this year, both have requested a $50 million Healthy Schools initiative at EPA. Congress has not picked it up. Our Coalition for Healthier Schools has requested $65 million. I'm sure we could come to an agreement anywhere in between those numbers, but we'd like to see something happen. And what would happen with that money is not bricks and mortar money, but it's used for education, training, and demonstration grants on things like indoor air. How do you fix the ventilation system? How do you fix your drinking water system? How do you do testing at the tap and so forth, as well as for the pediatric environmental health specialty units. So there are a couple of sources out there that people are working on very, very hard this week, and we don't know how that's all going to turn out. And with that, I will turn it back to you, Paul, and the moderator for questions, and thank you all so very much.
Yeah, thanks to both of you for an excellent presentation. It's really superb, and it has generated many, many questions. And so I'm going to turn the initial part of the Q&A over to Sharon. We'll probably run this at least about 4:15, 4:20. We don't want to skimp on the answers. So please, if you're able to, please stay with us for the next 20, 25 minutes or so. And at this point, I'll turn it over to Sharon to start with the first few questions.
Yeah, thank you so much. And thank you, Claire and Alan. Fantastic presentations. Lots of great questions coming through, so thank you to our participants for submitting those questions. I'm going to start with you, Carol. What recommendations do you have for how many days a school should stay closed in the event that there's a student or teacher who tests positive for COVID-19?
I'm sorry, that question for me?
Yeah, I'm sorry, Claire, yeah.
Yeah, okay. Oh, we didn't specify. That's a public health decision, and I think it depends on the number of cases and the size of the building, what's going on in the community. We specifically think these are very tough public health, state public health issues that a state needs to pay attention to in helping schools to reopen. So we did not name any number of days.
Thank you. So our next question, does a room with a confirmed case of COVID-19 need to be closed for 24 hours before disinfection begins? And if so, how long would that individual have to be in that room in order for that to be considered, like for more than 15 minutes, so an exposure? Claire, do you have any guidance on that?
There has been guidance on that, and part of it has to do with how long the virus lingers in the air and on hard surfaces, the fomites. So the advice has been to let a room sit for 24 hours if a person has been in it for an extended period of time, undefined, to let it sit for 24 hours, in which time some of the virus may deteriorate or deactivate. And some of the droplets and aerosolized particles would be landing on surfaces where they could be cleaned. And if somebody goes in, they need protective gear and a mask and so forth. I don't know if that's helpful or not, but that's where the 24 hours comes from. So the way the virus droplets land, the aerosolized particles can linger in the air for an extended period of time. That goes days, is my understanding. The fomites on hard surfaces can go for 3 days on steel and plastic, for example. And on softer surfaces like cardboard, I believe is about 24 hours. So there's a range, and there are a number of different publications on these. I hope all of them come to rest at some fixed points at some point. I think one of the challenges of all this is how much new science has had to be generated in order to get to answer any of these with any kind of certainty. We're in a very uncertain field at this point, and that includes a lot of information that people would love to have about children in COVID. And how easily they transmit it and how effective they are. Not a lot is known.
You're absolutely right. Allen, I am going to have some questions here for you. Lots of questions coming through on portable HEPA filtration. So I'm going to try to summarize some of these. But do you recommend portable HEPA filter units in classrooms or, the school nurse area? What are your thoughts on that?
Yes, in combination with proper ventilation controls that are already in place. Exhaust ventilation controls. So I don't want to give the idea that freestanding HEPA air purifying filter can take care of everything, and in the absence of good ventilation, but they are being recommended for use in addition and in high-risk areas. So that would be, if I'm thinking about a public school, that would be a nurse's office, the isolation room where you put individuals that are suspected to be infected, and I guess maybe in places like bathrooms. Actually, I don't really say it that much in there, but in the nurse's office and in the isolation room. And if you're interested in finding more information about it, ASHRAE put out a bunch of guidance documents on this, and I'm looking for the title of it right now on my folder. You'll see it as related to isolation rooms. So yes, there is recommendation for their use, but not as a substitute for good ventilation. Isolation rooms, I think is. Isolation rooms is where ASHRAE has a document about isolation rooms where they talk about those filters. If you're interested in looking further into that.
Great, and perhaps we can actually provide some of those references and information. Claire, do you have anything you would add to that?
No, not at the moment.
Okay, great. So we have some questions about social distancing and how do we do this safely? So for example, is indoor PE safe without masks, even when you're social distancing? And should masks be mandated? I'm going to start with you, Allen, and then perhaps Claire, you can also comment.
Yeah, sure. I think face coverings should be mandated nationally. And then I don't think I want to make sure I get clear the first part of your question where you mentioned PPE, because it's such a careful issue to talk about. Did you say that? Could you repeat that again, the first part?
Yeah, this is more about like physical education. So PE, dropping one of the P's.
Oh, sorry.
So yes, how do you do that safely? Or in chorus, or like when in band, how do they safely do that?
That's a long discussion. There's no consensus on how you do that safely, particularly band practice and PE. I think there are some things like running cross-country track, which sound easy. I think baseball is a great game that has some distance between people, and tennis, but team sports and indoor choir, indoor chorus practice, indoor music, indoor orchestra are probably not on anybody's short-term agenda, although individual music lessons might be. There's a real mix on what happens there. I think people need to proceed really with an abundance of caution, because we just don't understand as much as we need to understand.
Yeah, I agree. They should be outside. that's what you can do. Otherwise, they're in the category of high respiratory exchange. All those examples, and so those are really high risk.
Thank you both for your responses. I'm going to ask one more question and then see if Paul has some additional questions. But Alan, I'm wondering if you can comment a little bit, since with your background, on UV. We hear a lot about UV lighting, what can you tell us about that?
Yes, UV is somewhat of an easy one simply because it's actually been used to control tuberculosis in hospitals for a very long time. The thing is, what does the technology really look like? So is the UV in the air handling system, or is it in the upper area of the room where the lights kind of shoot sideways so that there's no risk that they could get into people's eyes where they could be really damaging? Or are these, I keep seeing these pictures of these robots like that roll around with UV lights on them. That seems a little more dangerous to me because, you know, UV light is dangerous to humans, especially to our eyes. And so we have to be careful with the way we use it. Anything that just came out within the past few years, I would be skeptical of, but anything that's been used for the past 60 years in hospitals, I would like to go with that. I just want to say that with a caveat that really consider what is the benefit that you're getting out of using the UV in your air handling system or in your rooms versus, for example, upgrading an HVAC system. I don't know what the costs are, but would you get less? Would you get a better outcome from just upgrading an HVAC system and having better ventilation versus installing a UV system, which will only be helpful for the next 2 years, and the upgraded HVAC system could last another 10 or 20?
I want to add to that a little bit. Schools are not high-tech places. They are not hospitals. They are not staffed with scientists and medical professionals. They do not have a high-tech staffing component. So when you're talking about an installation of a UV system, that is a very expensive high-tech installation that needs extensive outside consulting to get it right, and then it has to be maintained. And the one thing we have all learned about schools over the last years, decades, is they don't do a good job maintaining things. That's why the ventilation systems don't work. So I think that our preference is to make sure that if you're going to spend money, you're going to spend it on something that is very practical, that will last, that will work, and is not a drain on maintenance.
Great, thank you. I want to ask one more question, Alan, then I'll pass it over to Paul to see if he has any additional questions. But in an air-conditioned building, is it better to open the windows and let in the humid hot air, or is it better to keep the windows closed?
And so air conditioning, let's be careful here. So there's this idea of the air conditioner that might be, you know, in your house, this unit that you put in the window. That is not exhausting any air. It's recirculating the air, and so that's not doing what we want. If what we're talking about is a more traditional, like a centralized HVAC system or even decentralized HVAC system, which is ventilating and air conditioning, then yes, that's what we're looking for. We'd like every classroom to have a form of dedicated, you know, ventilation that takes out the air and mixes a little bit of it, but replaces it with fresh air then. But again, a regular window air conditioner is not doing what we want. And so, you know, I've already been to one school just last week, and we're trying to figure out how they're going to do this. You're going to have to open another window on the other side of the room to let fresh air in, but you can't just let fresh air in. You're supposed to filter it. You got to look out for security concerns. This is why engineered HVAC systems do all those things without the negative parts of it. Our building stock is just not equipped with it, and if it is, it's just not well maintained. I hope that answers the question, but if I can, I'll clarify it if you want to give me more clarification.
No, I think that's really helpful, so thanks for that clarification.
Okay, great, and thank you both, and thanks, Sharon, and Sharon, please continue to review some more of the questions that are popping in, and we'll try to get to as many of them as we can over the next 10 minutes or so. Question, I think, for Alan, perhaps. ASHRAE's guidance on opening schools in June 2020 recommended that HVAC systems during the pandemic disable any demand control ventilation and introduce the maximum possible outdoor airflow 24/7 until further notice. Do you know if any specific schools have found this to be feasible, and what is the relative increase in energy cost to achieve this?
No, I don't. And one of the main reasons goes back to what Claire said recently, that these schools, public schools, tend to not have that. That's something that comes from, if you've gotten your HVAC system upgraded in the past 10 years, you might have that demand ventilation control. And so none of the schools that we end up working with have that. They all have like really bad indoor air quality problems, so they don't have state-of-the-art systems. So I will point out though that something that people kind of don't realize, I think, it's really hot right now, but the baseline is 70 degrees. Oh, sorry, really hot where I am in New Jersey. The baseline is 70 degrees. 90 degrees seems really hot. How could you bring in all that fresh air? And so you're gonna have to condition all that extra air. That's only 20 degrees above baseline. In the winter, when it's, at least here in New Jersey again where we are, sometimes it's 20 degrees for a few days in a row. That's 50 degrees below baseline. So I know this isn't answering the question, but I do want to just kind of put in perspective, when we are using more fresh air than we should, we're always going to be fighting against whatever the baseline we want in the building, which is average 70 degrees. And so depending on when, the answer to your question really depends on what season we're doing this. Obviously, it's all year, I don't know, but the majority of it's going to be school year is in the winter, and we lose a lot of the summer. And so that is going to be an important question. How much more is it going to cost a school? It doesn't even have to be control ventilation. It could just be a lot of people use 5%, sometimes 0% fresh air in the winter. And we're asking for something like 15 or more. And in the winter when it's 20 degrees outside, I don't even know if an HVAC system can handle that. Your system might not be able to handle it. So that is a great question. Not only how much is it going to cost, but what can the system handle in terms of bringing in all that extra fresh air? And again, that's assuming that the building even has a functioning HVAC system, which many of these don't.
Okay, great. Thank you. Next question to Claire or to Alan is about the use of nebulizers by the school nurse for children with asthma. Would you advise withholding such treatments in a school nursing facility, or what would you recommend?
Well, a lot of school nurses are already doing nebulizing treatments in their nursing suites, and for that reason, they need N95 masks and protective gear. So that's it's something that happens in many urban schools all over the country. As you know, there's a practical, besides the pandemic, there's a practical epidemic of asthma among children. And in some school systems, the number of children with asthma may be as high as 40%. So it's really important to understand the world of public schools when we talk about reopening them, that they're not high-tech places, they're not staffed with scientists. They have a high percentage of children with special needs, particularly in urban areas. And I cannot stress enough, the communities hardest hit by COVID are going to be the communities to send their children to the poorest schools in the worst condition. It is really an extraordinary time. And to push reopening when schools aren't ready or families aren't ready is a very, very tough proposition.
Okay, great. Thank you. Another question is about the maximum number of people in a room, in a classroom. Should it be 10 or 25, or is there some sort of a recommendation in terms of the maximum number of children?
Well, it depends on the size of the room. So if you're going to practice 6-foot distancing, then you can only have a certain number. It may be only 9 or 10 seats can be taken. If you have a smaller room, it would be a smaller number. If you're trying to accommodate half of the class at once, it depends how large the classes are. Typically, rural and suburban schools typically may have smaller classrooms, but that's not always true. And urban schools can very often be very, very crowded, 40 children in a normal classroom. The other challenge is spacing out on buses. So a school bus that holds 77 passenger seats with spacing only can transport about 17 children. So how many bus runs do you need to be able to schedule and organize? So these are enormous logistical issues when you think about just the management of people that go into schools every day. Across the country, about 20% of the total American population is in a school during a school day. And those are the logistics you have to apply.
Wow. Okay, great. Thank you. This may have already been addressed, but for those classrooms where they are able to maintain a 6-foot physical distance, can the students remove their mask, or would you recommend continued mask use in the classroom despite the ability to maintain the 6-foot distancing?
In our report, we recommended that all staff and all students wear masks, and students, if they couldn't wear masks, wear face coverings. And if that was a problem, because it is for some children, they consult first with their medical provider or their healthcare provider and work it out with the school. There are clearly children with sensory difficulties, children who are medically complex, who have particular very complicated disabilities, and they may require hands-on teaching and hands-on learning. And so when you ask about protective gear and face masks and face shields and sneeze guards and everything else, I think everything comes into play depending on the population you're working with.
Okay, great. Thank you. You mentioned, previously the challenges with school band and chorus inside. How about recommendations for speech pathologists who are working closely one-on-one with children, but need to show them how to make sounds and are producing a lot of air?
Right, and you can't do that with a mask on either, and children who are hard of hearing or who are deaf and are lip reading. So there are some big challenges like that, and I think the face shields come into play in that kind of situation.
Okay, good. Interesting alternative there. Okay, another question is about the fact that there's been a lot of attention to the entry screening and mitigation strategies, but how about epi assessments of the school occupants to determine whether the incidence and prevalence of COVID is greater than the community levels to determine the success of the mitigation? Is there much going on regarding the approach to the epi of the school children and staff themselves?
I need you to start that question over again. Can you start at the beginning? It got a little, I'm
Sure,
not sure I fully understood it. Thank you.
No problem. So the question is that there's been a lot of attention to entry screening and other mitigation strategies, but no mention of epidemiological assessment of the school occupants, stratified by job function or the students themselves.
Right.
To determine whether the incidence is greater or less than in the community. Any thoughts about that?
That's why we want schools to report their attendance and their the infections to the state or local health department. There has to be a protocol for doing that so the state can keep up with it. That's a really good question, and I'm glad that came up. The other thing that comes up is this question about screening symptoms, because I think everyone has read that children are often asymptomatic. And in fact, both adults and children may be shedding a lot of virus before they ever run a temperature. So one of the concerns that's been prevalent in our, depending on what audience you're talking to, is whether or not a child with a temperature, irrespective of whether they've been diagnosed or not, is automatically quarantined and then therefore missing 2 full weeks of school. But in fact, they may simply have the cold, they may have another kind of flu, they may have something in passing that goes away for another day or two, but they certainly don't have COVID-19. So these are really, really tough questions in terms of access and accommodations of children. And it also applies to staff. You have very vulnerable staff, some of them older, 55 and older, who are in schools. There are plenty of teachers who are very deeply concerned about being able to return and teach in a crowded classroom or any kind of classroom that isn't very well ventilated. So there are no easy answers here, but one of them has to do with accommodation. There are a number of federal laws regarding accommodation of students as staff, ADA, 504, and IDEA for children, have to do with making provisions to make sure they can stay current with their, not only for an adult with their job and perhaps work from home in some kind of situation, or for children and how they work from home or come into school, depending on what their health status is.
Okay, great, thank you. A few more questions. One is a simple question. If the parent has tested positive for COVID, can they send their child to school?
I would say that they shouldn't.
Okay. Claire, any thoughts?
Not at this. I mean, this goes straight to the question of where the state is and where the region is in its transmission rate, and whether or not the child can do distance learning. I mean, you could have an entire family struck out one by one at a time, falling like dominoes over a period of 2 months, and a child who misses 2 months of school generally has to repeat a grade, and you certainly don't want that either. So I think this really gets to the heart of community transmission. I don't know the answer to it.
Okay, great, thank you. What happens if a child who's been wearing a mask is positive for COVID-19? Does the classmates need to undergo quarantine for a certain period of time because of the positive case?
Again, that's going to be that we would expect the state public health guidance to be very specific about how that needs to be handled when they direct schools to take care of that. That has to come from state public health or local public health agencies.
Yeah. Okay, great. Thank you. Could you please address access to hand washing and what should be the minimum requirements for that?
Well, there are obviously two different ways. There are a couple of different ways. One is there are sinks in schools, but they may not be enough to get everybody into the building, wash their hands, and get into a classroom. By that time, it's lunch already. So there are a number of options. One is hand sanitizing stations and hand sanitizers in classrooms. Another is hand washing stations, which are portable devices that sometimes are on athletic fields. But they can be rolled into into school hallways as well. So what we've read is that there's hand washing as children enter the building, before lunch, after lunch, depends what their activities are. So that's the general role of things, but I don't know. The variable would come in how many shifts of children are coming in and out of the building, and if they're changing classes frequently.
Okay, great. And by the way, some comments just came in from some of the registrants regarding the last couple of questions. So these were folks who work with the health department, said that the advice right now is not to send the child to school if the parent's positive. The child needs to be quarantined, and that per CDC, a child, if there's a contact that's positive, they need to be isolated for 14 days. Okay, Sharon, do you have any additional questions you'd like to ask?
I think just one more out there, because we see this a lot in healthcare as well, but I wonder, is there a safe way to be able to use rugs in a classroom that students sit on? And if so, should it be sanitized between uses?
To sit on a rug in a classroom, and should it be sanitized? Soft surfaces. There are products that worked on soft surfaces, and I would think you would want to, well, it depends. If you have a pod or a cohort group in one classroom that hasn't moved and they're sticking together for the full day, and that's their room, and no one else uses the room, you might not sanitize it every hour, right? Might be once a day, it might be every other day.
Yeah, and don't forget ultraviolet light. You can use that. I don't know if if this is a rug that's fixed to the floor or something that you can take outside. You want to be careful with disinfecting soft materials because the disinfectant can kind of stay in there and then accumulate over time and then revolatilize while the kids are sitting on the rug and maybe become exposed to too much disinfectant that way. And also don't forget that cloth surfaces and things dry out the virus faster than like hard surfaces.
Right. I want to mention something which hasn't come up. We're aware that there are some school districts that are sending around surveys saying, would you be comfortable if we did X, Y, Z? Would that make you comfortable enough to send your child to school? Do you think we can do it right? And I can see CDC has used some of these questions for parents to answer. It's really not the right question. The question is not whether they're comfortable, it's whether or not their child is safe. And so we're really recommending to parents that they ask some really specific questions. For example, has your school provided you a copy of its written protocol for cleaning and disinfecting? Has your school provided you with a written protocol for masks, for example, and face coverings? Have they told you how they're going to handle? Do you have it in writing? Do you have a written protocol for how active cases will be handled if they're in the school? Will you find out about it? Will anybody tell you? Do you know whether or not your school has addressed how it flushed out its water system after it's been unoccupied for 3 months? Do you have a record and a written protocol, a copy of it from the school for how the ventilation system is going to be operated? These are things that make sense to parents, and they have every right to know about them. And I would hope that state public health agencies, local public health agencies, and CDC for that matter, are forthright about saying parents deserve to know these things. It's not a question of comfort, it's not a question of belief, it's a question of what's happening.
Okay, great. Well, I think at this point we will end the presentation and the Q&A. There's still some additional questions in the queue, and we'll review the questions and try to get out an FAQ in the upcoming weeks that can address some of these. So I'd like to thank again our participants for the Q&A and for Sharon Van Norrisdale for helping with the moderation. If we could just move to the next slide. As mentioned at the outset, this webinar has been recorded and you'll receive a notification of when it's uploaded to the ACMT website. Should be on Friday or so. There's also a whole bunch of other FAQs as was mentioned, and if you have any questions you can contact us at info@acmt.net. Next slide. So we'll continue our webinar series next Wednesday, where we'll have a talk about racial and ethnic disparities during COVID-19. And the title of the specific presentation is Pandemic, Protests, and Politics, a Time for Reflection, Review, and Reaction. The president of the American Academy of Emergency Medicine, Lisa Morono, will be presenting along with Cheryl Heron, who's professor and vice chair of faculty, equity and engagement and empowerment at Emory University. So that's next Wednesday, August 5th, 2020 at 3 p.m. Eastern Time. Next slide. Again, I'd like to thank the speakers and the moderators today. This whole program can be accessed through our prospectus, which is also available on the website. All the preceding webinars as well as the upcoming webinars can be found in the prospectus. Thank you very much and have a good day.